Hey, I'm Brady Calhoun. I'm with News 13. We're doing a sort of a facts over fear session. We're going to be talking about vaccines. I'm joined by Heather Kretzer with the Florida Department of Health in Bay County. Heather, how you doing today?
Doing great. Thanks for having me on today.
All right. How many vaccines is Bay County getting each week?
So the Department of Health is getting 500. The county has been allotted 1,500 from the state, so the other 1,000 of that is going to Publix. And then we have, of course, the federal retail pharmacy program with those vaccines going directly to Walmart and Winn-Dixie here locally. I'm not sure exactly how many that those are getting a week, but they are getting some, and that's through the federal program rather than through the state programs.
So what's the total out of all that? Is it 1,500 or 2,000 a week? Or?
Well, I don't know how many are coming from the federal retail pharmacy program. There's 1,500 from the state that are coming to the county, and then in addition to that, a separate allocation from the federal retail pharmacy program that's going straight to Winn-Dixie and Walmart.
So far, how many vaccines has the health department done?
Well, I would have to go back and look at specifically at the health department, but as a county overall, we have 30,500 doses that have been administered, and 21,184 persons have been vaccinated.
So out of a county of somewhere around 180,000 people, we've vaccinated 20,000? Does that sound about right?
Yeah, 21,184, and I think it's around 178, but I know we're still getting those census figures and things back in, so
Sure.
kind of see where the population falls.
Who's gotten those vaccines?
So we have, of that, 54% of the vaccines that have been given to seniors, so that's persons that are 65 and older. Of course, healthcare providers are another segment that have received the vaccine, and then some of those persons that have been deemed vulnerable have received the vaccine. And of course, the governor has new executive orders that will allow additional persons to begin being vaccinated.
Who are those additional persons, and when does that start?
Sure. So this started yesterday. There's a new form that has been released by the Florida Department of Health, and this is something for people who are deemed vulnerable by their physician to COVID-19. Their doctors will be having those forms as well, but they're welcome to go and print that information and take it to their doctor's office for their visit. And under that executive order, anybody that's deemed to be vulnerable to COVID-19, once they have that form, then they can be vaccinated either by a physician, an advanced registered nurse practitioner, or a pharmacist. So currently in Bay County, those persons could be vaccinated at the pharmacy locations that are providing vaccine, and that's Publix, Winn-Dixie, and also Walmart. In addition to that, of course, because those persons that were vulnerable could be vaccinated before, but this just kind of clarifies that a little further and provides that form. In addition to that, it's K through 12 school employees that are 50 and older, law enforcement officers that are 50 and older, and firefighters who are 50 and older. And what the governor indicated yesterday in his news conference is he feels that those Johnson & Johnson vaccines the state will get later will be a good way to vaccinate those persons by using some closed, what we call pods or points of distribution. And with that, those persons will be able to have one dose and have a highly effective protection from COVID-19.
Is the demand still, early on in the first, I would say 2 weeks or 3 weeks, the demand was really, really strong from folks over 65. Is the demand still outstripping the supply for the most part?
Well, we're still able to fill those appointments. It's definitely not, as high of a demand as it was, but we've still been able to fill our appointments and get all our vaccines out. Again, we receive 500 at DOH Bay a week currently, and of course that could increase at any time. But our goal is always to get those vaccines out within 7 days, and we've been able to do that and make those appointments. And we're still also vaccinating healthcare providers as well who were not able to receive the vaccine through their employer, or if they're not affiliated with a hospital, and even some that are affiliated with hospitals are being vaccinated through some closed points of distribution that we're doing with some partner locations. So we're making sure that those persons are taken care of as well.
You're not having any leftovers or having to throw away any vaccines, are you?
No, we have not had any vaccines that we have thrown away, and neither have any of our partners that we provided vaccines to. The vials that we get from Moderna typically have 10 doses in it. Sometimes, depending on what type of needles, because we get in our kits, we have certain needles, and we have, of course, the doses. Some needles you can almost pull 11 every time, and then sometimes you get an 11th dose no matter what. But we definitely use all the doses that we are able to draw out. And once those vials are open, we have to use them within 6 hours. So we do our best to look at different lists and different people who would be under the executive orders that we can give those vaccines to and make sure that they're all utilized.
What kind of side effects are you seeing, or is the health department seeing, and the medical community seeing with the vaccine?
So for most people, it's going to be a lot of those side effects that you'll see on the CDC website. Typically kind of a sore arm, a red arm. They may have fatigue. Some people may have a headache. Some people may even run a fever. Most of those symptoms will resolve within 24 hours. But if they have any symptoms that, continue, or any concerns, they should always contact their healthcare provider, or they can contact us and let us know, because we'll want to know that information and help them to be able to report anything that's, an adverse side effect. We do watch those people, for 15 minutes after they've had the vaccine, and we have not had anybody that's had a reaction during that time period, and we're very thankful for that and hope that that continues.
Should people who have had COVID get the vaccine?
Absolutely. There is a little bit of a limitation on that, though. The natural immunity, they are saying, typically lasts for about 90 days. But if you are outside of your isolation window of that 10 days, then you could get the vaccine, as long as you weren't in the hospital or something for a while. Then that might be something you may want to talk to your doctor about before proceeding to get the vaccine. And if you've had any COVID-19 treatments and things like that, typically they ask that you wait 90 days before you get the vaccine if you've had any of those treatments while being hospitalized.
I want to talk about the two sort of separate groups. If I'm 65 or over and I want a vaccine and I haven't gotten it yet, I'm a Bay County resident, what's the best way for me to sort of get on the list and try and make that happen?
Right. Well, there's actually a few things that those persons can do. We do have that statewide pre-registration. If they have access to a computer or have somebody that can help them, they can go to myvaccine.fl.gov, and then they're going to click their county from the pull-down menu. If they're in Bay County, they'll click Bay County. Also, we have a phone number that persons can call, and that is 866-201-0712. Again, that's 866-201-0712. Of course, Publix is offering the vaccine, and they have their website, thepublix.com/COVID-vaccine. Walmart is walmart.com /COVID vaccine. And Winn-Dixie is winn-dixie.com /pharmacy /COVID-vaccine. There's also a vaccine locator that's on the floridahealth.gov website, and that may be easier for people that are trying to get this information, because that's going to be updated consistently with the locations and how to go about making an appointment.
What are the restrictions if I'm 65 and over? I have to be a Florida resident, but I don't necessarily have to be a Bay County resident, right? How does that work?
That's correct. So you just need to be a Florida resident. There are some people that are seasonal residents that can also be vaccinated. They just have to provide two different proofs. So that would be something like either a mortgage statement, a rental agreement, and then two pieces, or you have to have two proofs. So then another option could be to have mail that comes to that address that's either from a financial institution or from a government entity.
Like a water bill.
Right, a water bill would work too as well, utility hookup, those types of things. So that's some of the things that they can have in order to be vaccinated. And otherwise, if you're a Florida resident, either a driver's license or a Florida state-issued ID card.
Okay. So the other group, the group that's under 65 but they have pre-existing conditions, right now today, what do I do? Do I call my doctor? Do I go on a health department website? What do I do to try and sort of get on the list to get the vaccine?
So what those persons would need to do is to contact their doctor. Their doctor's offices should be receiving those forms today from the Department of Health, and they can contact their doctor if they want to go and download that form themselves. They can do that before their appointment as well, and that form is available at the floridahealth.gov, floridahealthcovid19.gov website. So then from there, then they can make an appointment with any of those pharmacies that are here in Bay County that are providing the vaccine. Right now, our mission with Department of Health is for those persons that are 65 and older, and also for those healthcare providers. And because the way the executive order is written, it allows for only those physicians, pharmacists, or advanced registered nurse practitioners to provide that vaccine. So that's another reason why they would need to check with those pharmacies about getting an appointment.
The Johnson and Johnson vaccine, you discussed that a little earlier. It's sort of starting to be distributed and be distributed widely. That's the one-shot vaccine. Is that any better or any worse than the other vaccine? Is there any reason why I would shun that one and try and get on a list for the other one?
Well, I think the important thing is to get the vaccine, no matter which one that you can get. The Johnson and Johnson vaccine has been proved highly effective against death, highly effective against hospitalization, highly effective against moderate illness. So people really need to focus on that and do their research, because there's going to be many different types of vaccines that are coming in. In fact, there were some Pfizer vaccines that Gulf Coast Regional Medical Center received this week. So it's not really going to be a point where people can really necessarily pick and choose. So just kind of research and know the information for themselves, and just take that vaccine, get the shot whenever you can, no matter which one it is that's being offered to you, because they're all highly effective against COVID-19 and protecting you from the adverse effects.
Keeping you out of the hospital, keeping you alive, and I mean, even keeping you from getting sort of seriously sick, right?
Absolutely.
I mean, those are all things I would want, I would think.
Right, and it's more similar kind of to a flu shot is what I like to kind of tell people, because the flu shots overall effectiveness can be very similar to what that Johnson and Johnson is, but it's still highly protective against preventing people from going into the hospital, having moderate illness, and those types of things. So if people kind of look at it from that lens, I think it can kind of help them better understand the effectiveness of that particular vaccine. And you only have to go once, so it really is very convenient. You just go get that one dose, and then you're done. And in 2 weeks, you're protected from COVID-19 and those very adverse effects.
Yeah, I mean, some people may prefer, if you're concerned about needles or whatever, you may prefer to get one shot as opposed to getting one and then coming back, a month later and getting that second shot. So the governor's order sort of opened it up for folks with pre-existing conditions. How long do you think it'll take before it's sort of widely open to everyone? Do we have any idea?
Well, this is going to be up to the governor, and I know from the standpoint, they're continuing to look at that data. They're looking at, what percentage of our seniors have been vaccinated. Here in Bay County, we've had 54% that have been vaccinated. Then they're going to start looking at, of course, with the new 50 plus for those certain populations, the school employees, firefighters, police officers. Then they're going to look at, are all those people taken care of? And then he's probably going, and looking at the doses we have coming in. So they definitely are continuing to look at those things and look at what those next phases will look like. And as we get the information from the governor, we will be sharing that out.
What are the big questions you're hearing from the public? What are things that you guys sort of deal with on maybe a daily basis or a regular basis when you're talking to the public?
I think, of course, that's one of the biggest questions. When can everybody be vaccinated? Before that, of course, it was when can people with underlying health issues be vaccinated? Now we have an answer to that. So those are really the two main questions we're getting right now. A lot of times people will ask, well, I'm a caregiver of someone with one of those underlying health conditions. A lot of those people are wondering when they can be vaccinated too. And of course, we're just continue to follow those governor's executive orders, and that's some of the main questions that we're getting right now.
Okay. If you're on Facebook and watching us, we appreciate you for joining us. We're looking at if you've got some questions there. One of the questions we got is post-vaccine guidelines. So I guess I've gotten the vaccine. What can I do or not do? Do I need to stay out of the sun? Do I need to stay off antibiotics or whatever? What do I need to do after I've gotten the vaccine?
Some people will have some temporary side effects potentially for 24 hours or so. So just, treating those if you have a fever and things like that, treating those as you would if any time that you're sick. We still recommend that people, while we continue the vaccination efforts, people continue to social distance, to wear a mask, continue to do the frequent hand washing to protect themselves and protect others from COVID-19 until we get enough people vaccinated that we have more of that herd immunity.
Can I, if I have a headache or some other side effect, can I take aspirin? Can I take Tylenol? Is there something that says I can't take any sort of pain medication?
No, there's nothing that says that you can't take it. There has been some guidance from the CDC that's came out on that, is kind of really treating the symptoms, but not necessarily taking anything in advance of that vaccine.
Okay.
And of course, as always, if you have any concerns, it's always best to contact their healthcare provider who's going to know their health history the best and is going to be able to guide them with that.
There aren't any, and the other thing is there aren't any are there any medications that people are on sort of routinely, whether it's blood pressure medication or anything else, that will have any kind of counter issues with taking the vaccine? Is there anything like that? Or, again, is that really a question for folks, for your doctor?
Yeah, that's really going to be a question more for their healthcare provider. Of course, there's some information, about those vaccines on the CDC and other websites, but it's always best to talk to your provider because they're going to know your health history and all the details surrounding that and going to be able to best guide you.
Is there anything else that we haven't touched on that you want the public to sort of know about the vaccine, about the distribution? Anything that we need to share?
Well, we just really are encouraging people that when it is their turn to go ahead and take the shot and do their research and stuff. If they have reservations, check into it. We definitely want as many people as possible to get vaccinated because it's going to protect themselves, it's going to protect the people that they interact with, and it's going to help us all be able to move back to that normalcy.
Yeah. And research obviously means, speaking to a doctor or researching from I guess the phrase I would use is a legitimate source of medical information, right?
Absolutely. They can look at the FDA's emergency use authorizations on the different vaccines, going to those vaccines sites themselves, also going to the CDC website, the Florida Department of Health. So looking at those reputable sources of information. There is a lot of misinformation out there on the internet, in particular for any and all vaccines, really. So just making sure that they know that it's a trusted source for information. And a lot of times people are going to trust their healthcare provider even more so than some of those things. So having that relationship with that healthcare provider and being able to talk to them about it, I think is very important.
All right. Well, Heather, thank you for your time.
Thank you.
Thanks for joining us. Guys, thanks for watching, and we'll catch you next time.
All right. Thank you.